Good morning, everybody. Happy Friday. It's Friday the 13th, so be careful out there. It is also Fibromyalgia Awareness Day. And fibromyalgia is a really interesting disease complex. And I will admit that years ago when I was in the emergency department, I kind of wrote people off and thought it was kind of all in their head because the compilation of symptoms are just so diverse and varied and really just hard to pinpoint one thing wrong. In fact, most blood tests and physical exams will not reveal anything going on, but people are suffering. They're having weight with their metabolism, their weight, hair loss, pain, overwhelming fatigue, depression, some anxiety, inability to tolerate things they're normally able to tolerate, like perfumes or scents or noise or light. And it's really kind of irritating and debilitating for the patient. And now that I'm a functional medicine provider, I have a much better handle on what's going on. And it looks like it really all ties back down to the mitochondria. The mitochondria are these amazing powerhouses within each of the cells in our body. And there are millions of them. And they basically create energy for us. And so imagine if you have these powerhouse units that are basically shutting down because of many things we'll get into in a second, but you just don't have the energy to detoxify, to wake up, to move, to have your metabolism. So even though all your hormones may be in a line and all your blood tests are perfect going down the line, you just don't have the energy to take care of your basic needs. So what do we do about this? Well, we've kind of got to first figure out why. So we go back into your history and ask, when were you last well? Then what kind of happened from there, so we can tease out whether it's a toxic problem, whether it's an infectious problem like Lyme disease or CMV, or now we're seeing it with coronavirus, right? The COVID long haulers are basically having problems with their mitochondria as well. Or it could be heavy metal toxicity, it could be stress, trauma, all kinds of things could happen. So we kind of tease that out and try to address all those individually. And then we do offer some help, so there are some basic nutritional changes that we can make that will help, and functional lifestyle changes that we can help. There are vitamins and supplements. Here we also have IV infusion therapy where we can give you big doses of vitamin C, kind of help you kind of just reset antiviral properties and help with inflammation that way. We also have glutathione, which is an amazing detoxifier, and B vitamins, which help kind of rebuild the energy system and kind of rebuild those mitochondria. We also have NAD therapy, and that is an amazing game changer. And that basically, back in your high school chemistry, in the Krebs cycle, kind of creating energy in ATP, which is what the mitochondria make to give us energy. Well, NAD is an integral part of that. So we can give that by infusion, and people just feel amazing with that. Anyway, if you were suffering from fibromyalgia, or somebody who's suffering, please give them our number, get a hold of us, however you can, get them in here so we can talk to them and kind of give them some hope and reset their life. All right, have an awesome weekend, and I will talk to you soon.